For range of motion testing for hip flexion, you want to have the patient lying on their back, and so that their hips are flat on the table. If you want, you can have your patient put their hand on their stomach as to not interfere with hip flexion. So essentially what you want to do is you want to put the goniometer at the greater trochanter of the femur, and how you would find that is you can palpate, and if you're having trouble finding it, you can internally or externally rotate the leg so that you can kind of have an easier job finding it. Something around here. So you want to have the goniometer, the fulcrum, on the greater trochanter of the femur, and then you put the working arm in line with the leg here, and then the stationary arm straight. And then what you would do is you would have the patient flex their leg as such. You place everything, and then line up. So then you would have 110 degrees of hip flexion, which is the normal range of motion. For the range of motion test for hip extension, you would have the patient lying on prone with a pillow beneath their chest so that their hips are still touching the table. And then you want to again find the greater trochanter of the femur. And then what you would do is now you would put the stationary arm here and the working arm here again. And then you would have the patient lift their leg up, and then you would the read. And the read is 25 degrees of motion, which is a normal range of motion. For the range of motion test for hip abduction, to prepare you would normally be standing on a step stool maybe, but in this case not, because it's already all set. So what you want to do is you want to have your patient lying on their back again, and then you just want to explain to your patient what you'll be doing. So then what I'm going to do, Anna, is I'm going to be palpating for your hip bones, essentially. And then when I find them, I want you to mark them so that I can continue working. Is that okay? Mm-hmm. Perfect. So what you want to do is you want to start off with open hands. You kind of just start high, move low until you find them. Use your thumbs to mark them, and then tell your patient with the index fingers, keep them there. Perfect. And then you would take your goniometer and have the fulcrum on the working side of the leg. So in this case, I'm working on her right side, so then it would be on the right finger here. And then you want it perpendicular with the other hip bone. And then you want the working arm parallel with the leg you're working on. So now for a abduction, what we're going to do is we're going to have you move your leg out, so there you go. So then there's a little bit of internal rotation, internal rotation. So we're going to move it that way just a little bit. Take our read. This was 55 degrees of hip abduction, which would be a normal range of motion. For the range of motion testing for a deduction, you want to have the patient set up exactly the same way as you would a abduction. We already have the patient marking down their ASIS, and their opposite leg is already abducted so that we have more room for the leg that will be doing a deduction. So then you would place, with the goniometer, you would place the fulcrum and the working arm, or everything, in the same exact spot, and then you would have the patient deduct. So there we go. So now the range of motion is 20 degrees, which is a normal range of motion. for the range of motion test for internal rotation, you would have the patient seated with their legs or the knee flexed at 90 degrees. And then you would have the goniometer. The fulcrum would be right here in the middle. There's two ways you can go about with putting the stationary arm. You can either have the stationary arm parallel to the floor, or you can have it perpendicular to the floor. I personally prefer perpendicular to the floor. So then to internally rotate the hip, you would have the patient swing their leg outward this way, so that the patient will loosen up. And then you can see there's a little bit of compensation on the other side of the leg. It's totally normal, a lot of people are doing that. And then that's easy. Okay. And then the range of motion is 25 degrees, which is a normal range of motion. So for the range of motion testing for external rotation, the setup is exactly the same. The goniometer, fulcrum right in the middle, perpendicular to the floor. And then to externally rotate the hip, you would have the patient swing their leg inward. So do that. With the reading, and it was 35 degrees of motion, which is the normal range of